there's a world of technology coming out, and probably no more places more evident than in healthcare, where we see some really major shifts in the way things have been done. So really, we're going to look at it in the course of three different ways. The first we want to look at is how does it pertain to drug price transparency? Where does that take us from the concept of value-based care? And how do we start looking at the patient as a consumer and the concept of consumerism? Scott, would you care to comment on what you're seeing from a regulatory and legislative perspective as it pertains to drug price transparency?
There's certainly been a lot of activity recently in Washington, D.C. around drug price transparency. So on the regulatory front, in November of last year, CMS actually published a proposed rule in the Federal Register, and one of the provisions of the proposed rule was that by the end of 2019, all Medicare Part D and Medicare Advantage plans offer real-time benefit tools to allow patients to have drug price transparency at the point of prescribing. Now, on the legislative front, Congress last year also passed the H.R. 6 bill, and there was a provision within the H.R. 6 bill that would require electronic prior authorization to be mandated for all providers by the end of 2019 as well.
Thank you, Scott. So Joe, I want to kind of turn it over to you from a technology perspective and to get your take on what a hub service provider will need to do in order to kind of comply with this changing landscape.
Three key things come into play with a technology platform for these services today. First, a system has got to be interoperable, so it can tie into the EMR systems out in the marketplace. Secondly, it's got to have an open services architecture, so it can tie into e-service providers. And then lastly, it needs to be able to integrate in with partners, whether that's pharmaceutical manufacturer internal systems, whether that's other partners who are part of providing the overall patient services support program.
Moving into our second topic of value-based care. We see a major shift out there in the marketplace of a fee-for-service model to a pay-for-performance model. So looking at that in the concept of the role that a hub will play in that shifting paradigm, Scott, could you please comment?
One of the bigger challenges in the marketplace around value-based contracting has really been alignment between payers and providers, the two key stakeholders in the ecosystem. I think a hub is uniquely positioned to help bridge that gap between those two key stakeholders, simply because it sort of resides in the middle and is able to collect lots of different data points around patients that can ultimately help measure outcomes.
Kelly, we talked a little bit there about the hub's role in value-based care. Would you please expound on how you see how copay or affordability fits into this landscape?
Sure. Affordability programs are an essential component to the total access solution put in place for patients and how we support them in access to their drugs and therapy. You know, the cost of drugs and the patient out of pocket is one of the biggest barriers, and by putting a cost-sharing program in place, it removes that barrier and allows for the hub services and also for the affordability program to really bring about and have measured outcomes that can be applied to the effectiveness, to determine the effectiveness of the total support service program.
Joe, could you comment on the outcome of all this is what we know is the rich data that goes back to manufacturers and how hub providers must report?
Scott alluded to the outcomes data that you can obtain from these hub programs. I think offering manufacturers a self-service reporting tool to where the manufacturers and their teams can do queries on their own, as well as supported by their hub services partner, to where they can really mine that rich data that's available and look at the data from various aspects, cut it in various manners, and then share that with payers as part of their value-based contracting strategy. I think that's essential for their manufacturer partners.
Fantastic, thank you. Scott, would you care to comment on how you see the hub having to play a very important role in embracing consumerism?
Just like consumers, patients value choice. And the ability for a hub provider to offer a multi-channel strategy for engaging with the hub, I think is key. And for some patients, it may be as simple as, a hub case manager picking up the phone to interact with the patient that way. But for other patients, it may be utilizing a smartphone and a channel like SMS text messaging.
Joe, coming over to you, how does a hub best deliver personalized interventions with patients?
They've got to be able to do it through a digital platform. Mobile phones are a part of our daily lives now. And so the ability to engage a patient, provide them services, allow them to do things from enroll, access statuses, access affordability information at the right time, the right place or environment where they want to, is the mobile phone is how you do that. So we've got to meet these patients where they are. We've got to be able to integrate into their daily lives and make it part of their routine. And I think that's what a digital platform allows us to do.
Thank you for your time. We hope that you found this to be informative. If you're a pharmaceutical manufacturer, we recommend that you look at drug price transparency, value-based care, and consumerism in the design and execution of your hub program.